Good morning, Ma'am AZ. Good morning, classmates. I'm your RT physician for today, Ryaan Gayak. And today we're going to be performing the return demonstration of the spirometry. In the spirometry, there is a testing called pulmonary function test. This is a test that measures an non-invasive test that measures the lung capacity and strength of your lungs. This is measured through flow of rates, through your forced expiratory, to your FEVC, and all those stuff. So basically, within this testing, we can figure out whether it is a severe case or a moderate case for the patient. In a severe case, we might have to ask a physician's opinion or consultation for any treatment or future medication and cure for the patient's lungs. Thank you. During the overview, now I'm going to list down the objectives of the spirometry pulmonary function test. So first of all, identifying the presence of any lung absence or lung diseases due to the history of the patient, for example, smoking or any hereditary lung disease. And then second, quantifying the severity of the lung disease or the lung health. And then third, assessing the change of lungs health throughout time by the use of therapy and the use of future PFTs. And then third, assessing the effects and response of lungs towards the outside environment. And then third, assessing any surgical possibility that we could give to the patient in order for future treatment. And then lastly, assessing any impairment or disabilities that could be referred to rehabilitation. Disclaimer: before starting out your PFT procedure through the spirometry, make sure your patient doesn't have any of these contraindications. First of all, ask your patient if they've been in a recent surgery concerning their thoracic area or their eye area. And then second, check if the patient is suffering through any cerebral, thoracic, or abdominal aneurysm. This might puncture the aneurysm area once they're performing the test. And then third, ask them if they are suffering through cardiovascular illness of cardiovascular status, pneumothorax, pneumonia, or hemoptysis of the unknown region. Because all of these tests might affect highly the lungs and... We moved it earlier! Start? So before starting our return demonstration of the PFT through spirometer machine, of course, we need the spirometry machine. And then after that, we need the mouthpiece. And then, of course, we shouldn't forget our bronchodilators, just in case any emergency occurs where a patient has an asthma attack. And then, after that, our intubation emergency kit, antitracheal tube, laryngomask airway, and your duodenal airway, and also, of course, your laryngoscope with all the decent sizes. And then lastly, our patient's nose clip. So now, after explaining the equipment and showing the objectives and other necessities for performing the PFT, now we're gonna demonstrate the actual return demonstration of it. First of all, always remember that it's a main rule in every return demonstration that you have an interaction with the patient to perform hand washing. Performing hand washing avoids any contamination or infection within the area and the safety of the own patient. And then after that, after performing hand washing, make sure that all your equipments are within the hand of reach. Your intubation kit, bronchodilators, mouthpiece, spirometer, and your nose clip. And then after that, introduce yourself to the patient and also make them identify the problems and the testings we're going to be performing today. Once they know you and they know what they're going to be doing today, it gives them more comfortability and removes their anxiety, which gives a better result. Good morning, Mr. Sian. I'll be your RT physician today, Ryaan Gayak, and we're going to be performing your pulmonary function test. In this pulmonary function test, it consists of many different breathing types of your tidal breathing that will determine the results of your SVC, FVC, and MVV. It's just going to be a countless amount of inhale, exhale, inhale, exhale. Is that fine with you?
Yes.
Okay. Okay. After that, we're gonna be asking the patient if they have followed the guidelines we have given them. The guidelines are basically not smoking before the testing, or not drinking anything that could increase the heart rate or blood pressure of the patient. Asking them and them clarifying this makes sure that the accuracy of the test is 100% and there's no any contraindications. So have you followed the guidelines you have given yesterday, sir?
Yep.
Okay, that's great to hear. And then after that, after knowing all of this, now we're gonna obtain pertinent data to start up the spirometry test. Obtaining pertinent data, for example, the height, the ethnicity, and the environment he lives in is a key factor for giving a perfect accuracy. So I'm gonna be listing down your data right now. I'll just ask you a couple of questions and then just answer them back, okay? So sir, where were you born?
In Saudi Arabia.
How old are you right now?
16.
What's your height?
5'6".
What's your ethnicity?
Asian.
Okay. After obtaining pertinent data, now we instruct the patient to sit upright. Instructing the patient to sit upright gives us a better result of the lungs test. Sir, okay, sit upright. Your back against the seat. Okay, that's good. And then after that, now we can now we're gonna assemble all the necessity equipments in order for the testing. So first, we should put the spirometer, the mouthpiece of the spirometer, give it to the patient, and the nose clip. And then always make sure that your bronchodilators are ready, just in case an asthma attack comes in. So now we're gonna perform the 3 tests: FVC, SVC, MVV. And within those tests, we're gonna coach, make the patient practice, and guide them throughout the test. After introducing yourself to the patient and explaining them what we're going to be doing today, before we get started, we need to coach, instruct the patient, and make them practice to do it. Because having them, giving them a rehearsal with the return memorization of this test will increase the accuracy and will help the patient be more comfortable with the physician and with the test that's going to be in hand. So, sir, first of all, we're going to be doing your MVC. I'm going to check if the machine is starting. Yeah, it's starting. So basically, sir, in this test, we're going to be performing 3 normal tidal breaths. And then, after your 3 normal tidal breaths, you inhale, fill your lungs up, and then exhale for 6 seconds. Exhale, exhale, exhale as much as you can, and then inhale again. Okay, let's try doing it. So first, inhale, exhale, inhale, exhale, inhale, exhale, inhale, blow, 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 exhale, 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 and then inhale. Okay, so how are you feeling, sir? Are you feeling alright? You need to check the patient's condition right after performing the test, whether they need to rest or no. Okay, now that we instructed the patient, made them rehearse and made them perform a research demonstration with our coaching, now we're going to be doing the actual test, okay? Are you ready, sir? Here you go, sir, your nose clip. Make sure that it's in hand. Also make sure that all your stuff are here, your bronchodilators, your emergency kit, and your spirometer is working properly. So, sir, again, 3 normal tidal breathings, and then as soon as you inhale, you fill up your lungs, exhale with the mouthpiece inside your mouth, and then inhale again with the mouthpiece inside your mouth, okay? Here you go, sir. So, 3 tidal breathings. Exhale. No, inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale, 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 blow. Inhale. Okay, that's good, sir. It's time to take it out, sir. How are you feeling, sir? Okay, make sure that your patient is feeling alright after the condition test, because their condition highly depends on it, okay? So, with this test, as you see, we made the patient blow out as much air for 6 seconds. So that might be tiring, but we need to obtain at least 3 tries. So, basically we're going to make him try and try again until he's tired, and then after that, we're going to be taking the best out of the 3. So that's it, sir, for your FVC test. Thank you very much, and now we're going to be doing your SVV and your MVV. So after successfully doing the FVC test, make sure that your patient gets sufficient rest every test. Giving them a proper rest gives more accurate result as always, and it gives them more confidence to doing the next test. So now we're going to be doing the SVC or slow vital capacity test. Before doing so, just like before, explain to the patient, code drill and start. So, Mr. Ryaan, we're going to be doing your SVC test today. Just like the one before, 3 normal breathings. And then now, we're going to exhale maximally, and then inhale maximally. Exhale maximally, and then inhale maximally. Okay? Until the test. So now, I'm going to be, let's do a little bit of a return demonstration of it before starting it up. Inhale, exhale. Inhale, exhale. Inhale, exhale. Now, inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Make sure that the patient is maximally inhaling and exhaling at the same time. Now for the test. So make sure to put your nose clip first. Now we're going to be starting with the test. Here you go, sir. First, make sure that it's tight. It's the lip sealed tight inside your mouth. So can you kindly put it in, sir? Now. Okay, so let's start. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Blow. Inhale, exhale. Okay, sir, the test is over. That's good. How are you feeling, sir? Are you feeling alright?
Yeah, it's alright.
Okay. Okay, give me your nose, please, sir. So that was a successful FVC, and we're going to obtain at least 3 samples of it in an actual SVC test. Now, give your patient sufficient rest, and we're going to be doing the next step of the PFT test, which is MVV. So after giving the patient sufficient rest for them to obtain maximal effort, now we're going to be moving on to our next test, the MVV. Now, we're going to consult our patient first before starting out for them to be more comfortable and to them to practice. So sir, we're going to be performing the last test now. It's a little bit difficult, but we can do this together. It's called the MVV, where you get, as usual, you get 3 normal breaths. But then now for 10 seconds to 15 seconds, you're going to be breathing in and out, as deep as you can, and also as fast as you can. Can you do that? Okay, so first, let's practice. So sir, inhale, exhale. 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 Okay, sir, that's good. But now in our, how are you feeling, sir? Are you feeling alright?
I would didn't hear.
Okay. If we can do this now, can you give more effort into it when you're inhaling and exhaling?
Yeah.
Okay. So here you go, sir. Your nose clips. And then your spirometer. So sir, you don't put it directly right now. You put it after the 3 normal tidal breaths. Okay? So, inhale, exhale. Inhale, exhale. Inhale, exhale. Put it a little more. Okay? Inhale, exhale. Now, put it in. Inhale, exhale, 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 inhale, exhale. Okay, that's good, sir. That's good, that's good. Good results. Okay. How are you feeling, sir? Are you feeling alright?
Yeah, kind of alright.
Okay. It's good to hear. After doing all the tests, congratulate your patient and thank them for their cooperation. That will give them more confidence to come for more test results. So, sir, can you guys stand up? Thank you for the test today. You've been very cooperative, and I'm glad that all our tests are complete. So after that, you're gonna print the results and make the patient read it, and then make them go to his consultation. So, sir, here's your results, sir. Pretty good results. Now, can you go to your consultation? and talk to them about your results. Thank you very much.
Thank you.
After the patient leaves, make sure to do aftercare. Cleaning up after your things is important in order to sanitize and avoid any contamination of the area. And the mouthpiece is disposable, so you have to throw it. And then after that, after doing aftercare, make sure to input pertinent data. Inputting the pertinent data helps for more progressive idea of the patient next time he comes for a test. Thank you very much, and that's the RD for our spirometer pulmonary function test.